Bismillahirrahmanirrahim. Welcome to ERA. I am Dr. Muhammad Talat, Assistant Professor of Radiology, Cairo University. Today, we will focus on one of the most important complications of head trauma, brain herniation. In case of head trauma, you should search for any complications. We will conclude, or we will summarize these complications. First, edema, brain edema. Second, brain herniation. Third, hydrocephalus. Fourth, encephalocele. So, in case of trauma, you should search for these complications: brain edema and brain herniation and hydrocephalus. Those complications can occur early after trauma. Hydrocephalus can occur late also. Encephalocele, it is a late complication. Brain herniation is very important because it can occur in case of trauma. It can occur secondary to any space-occupying lesion, hematoma or tumor or something like this. So we will focus today on the brain herniation. I shared with you very illustrative image from Radiopedia to identify different types of brain herniation. One of the most common type is a subfalcine brain herniation. Subfalcine means that there is a brain tissue herniating from one side to another side, inferior to the falx cerebri. This one is the falx cerebri, so this one is called subfalcine brain herniation. Subfalcine brain herniation, it is very important because it can lead to compromise of the anterior cerebral artery, because this is a course. Let us change the color. This is a course of the anterior cerebral artery. So compromise of the anterior cerebral artery can lead to acute infarction along the anterior cerebral artery. The second type of the brain herniation is a transtentorial brain herniation. Transtentorial brain herniation can be divided into descending and ascending. If we start here, if we have here any space-occupying lesion at this area, it will push the brain tissue downward. And if we have here space-occupying lesion, or if we have here any hematoma or something like this, it will push the brain tissue downward. So we have here the tentorial cerebral line here and here. So any brain tissue crossing here, if it is going from lateral to medial, this is the uncal herniation, and this is the central herniation. So the transtentorial brain herniation, it is divided into ascending and descending, and the descending is divided into either uncal or central herniation. If we have any space-occupying lesion here or collection in the posterior fossa, it can push the brain tissue from inferior to superior. So we have here transtentorial ascending herniation. So the second type of the brain herniation is the transtentorial brain herniation. It can be divided into ascending or descending. The descending is divided into uncal brain herniation or central brain herniation according to the mass. If the mass is present here, for example, in the thalamus or basic ganglia, it will cause central brain herniation. If the mass is going to be located here in the temporal region, it can cause uncal brain herniation. So uncal brain herniation is a subtype of transtentorial descending brain herniation. One of the most important points here in the uncal brain herniation is the compromise of the posterior cerebral artery, because the posterior cerebral artery is going here. This is a course, so it can be compromised and can lead to infarction along the territory of the posterior cerebral artery. Also, we have another type of brain herniation called tonsillar brain herniation. If we have any masses here in the brain stem, it will push the cerebral tonsil into the foramen magnum and can lead to make a significant compromise upon the spinal cord. Also, we have another type, less common, called transcranial brain herniation. Transcranial means if the brain tissue is herniating from inside to outside across the skull bone. So this one is called transcranial brain herniation. So we have many different types of brain herniation: subfalcine, transtentorial, tonsillar, and transcranial brain herniation. Thank you so much. Thank you for listening to our lectures.